Hello and very warm welcome to the Arise interview, 60 minutes of big questions about the big stories from the news and beyond, with fresh insight and critical analysis. I am Christian Oguche. Thanks for joining us. We're live in Nigeria's capital, Abuja. Coming up in the next hour, there is an increasing burden of non-communicable diseases in Nigeria. Research by the World Health Organization in 2018 shows that an estimated 29% of deaths in the said year were attributed to non-communicable diseases. And a new study has shown that 3/4 of the 200 million Nigerians are at risk of non-communicable diseases amid the novel coronavirus pandemic. The study also found out that men are more at risk than women. Glaringly, there is need to improve wellness, promote individual health care and strategies, as well as provoke action from civil society and government at all levels. Today, we'll speak to some drivers of non-communicable disease awareness campaign in Nigeria. And every year, about 40 million people around the world die of non-communicable diseases such as heart and respiratory ailments, diabetes and cancer. More troubling is that these persons with such diseases are at higher risk of complications from COVID-19. Researchers say 2/3 of premature non-communicable disease deaths among adults can be traced back to behaviors initiated during youth and the period of adolescence. However, the prevention of NCDs, as shown by the World Health Organization, can reduce premature deaths, and Nigeria has instituted policies and plans to reduce the burden of non-communicable diseases. So, how far has the country fared? For more on this, I'm now being joined by Joan Alaboson, a medical doctor and public health professional, and in our off-site studios by Jerry Oguche, a registered nurse and head of nursing department at Peak Integrated Wellness Center with experience in both public and private sectors in Nigeria. Very warm welcome, Dr. Priye and Jerry Oguche in our off-site studio. Let me start with you, Dr. Joan. What's the strategic plan that Nigeria has for NCDs? I know there was an action plan that was enacted or rolled out in 2013. Has anything much changed in that plan by the federal government?
Well, the federal government since 2013 has updated that plan. It updated it in 2015. And I think over the years, quite a lot of discussion and, improvements have happened. As at last year, 2019, again, the government launched a national multi-sectoral action plan on preventing and controlling NCDs in Nigeria. And I think the reason that was done was to take into consideration the different sectors that are involved in preventing NCDs. Again, because the risk factors transcend just health and get into agriculture, get into public planning, get into other sectors of the Nigerian economy, that motivated that launch. And I think going forward, one of the things that the government is really looking to do is to characterize the risk factors for NCDs in Nigeria. So yes, the government is on the right path.
So if you want to look at the risk factors, are they very high? Because you had, in our intro, wellness and this non-communicable diseases are lifestyles that are, imbued in one from youth and maybe the period of adolescence and the rest. How about those who suffer such in adulthood?
Like you said, the behaviors that people eventually get to live with when they're adults actually start when they're adolescents. And some of these risk factors that have been identified and linked to NCDs, things like physical activity, which is low, unhealthy diets. These risk factors actually start when people are younger. And even though we don't have a lot of studies to actually tell us specifically the burden in Nigeria, we do know that 3/4 of Nigerians adults are actually
at risk.
At risk.
Of any of the NCDs.
Any of the NCDs, but in particular with low physical activity.
But some can be hereditary, as we hear.
Yes. So some risk factors are modifiable, some like the ones I mentioned, in addition to tobacco use and alcohol use. These are choices, but some are not, like genetics. So of course, people who have a family history, for instance, of any of the NCDs, cancer, cardiovascular disease, those kinds of people are also at risk for developing NCDs. That's not modifiable. We cannot change our family members. We can't change our family history.
I'm happy you talked about genetics, genealogical composition and things like that, because we still have families. You still see some families, who've got great health
Yes.
around them, living into, becoming centenarians or octogenarians, and the rest.
Yeah, I agree with you. I think that's why some other factors are environmental. So even if we do have a great family history, if we then imbibe these of longevity, exactly. If the individual imbibes low physical activity, eats unhealthy diet, smokes, then he or she increases his risk all the same, regardless of the
genealogical composition.
Family history.
Okay, let's go to the offsite studios now and join Jerry Oguche. He's a registered nurse. Jerry, tell us, what's your experience been, as a frontline worker in the control, treatment, management of NCDs, that is non-communicable diseases in Nigeria? You've gotten experience both in the public and the private sector. How can you reconcile these experiences?
Okay, hi everyone. For me, I think with my experience over the years, the issue that I see most especially is the issue of awareness, knowledge. For instance, in the country, many people do not even know that, let's take obesity, for instance. Obesity is a challenge. Meanwhile, over the years, obesity has become a global challenge, a very big problem. I did a research.
Okay, Oguche's audio is back there. I think team of engineers would rectify that. So, Joan, let's continue with you. Now, the great debate is between health and wellness. What's the remarkable difference between health? Because somebody that is healthy, what wellness is he looking for again?
Well, that's an interesting way to put it. But, even the WHO defines health as not just the absence of disease, but then health has to be defined across different dimensions, which are sometimes not traditionally thought of as the dimensions of health. For instance, spiritual health, for instance, emotional health. But the debate about wellness is about shifting the paradigm, or shifting our attention from not just preventing and treating disease, not just from not just treating diseases, to actually preventing the diseases and spending more energy on living healthy, because that's actually possible. So it's not a debate as such, it's just a further way of thinking about health prevention as a whole.
Yeah, and in preventing, communicable diseases and the rest, lifestyle is always brought to the fore, apart from the other natural conditions that, could run in family genes and the rest. But tell us the burden of communicable diseases in Nigeria.
Well, communicable diseases, according to the WHO, the World Health Organization, are on the rise or is on the rise. And it's estimated to cost about 30% of deaths. As at 2018, this was estimated to be somewhere in the range of 29% in specific terms. And of the communicable diseases, which I said before, include cancer, cardiovascular diseases, amongst others. Cardiovascular diseases contribute the greatest, and that was about 11%, estimated to be about 11% in 2018.
Isn't the issues of kidney, retina, problems and the rest now coming to join that pack?
Well, cardiovascular disease really talk about diseases that affect the blood vessels that supply the heart and the brain. But obviously, the main risk factor for cardiovascular disease is hypertension.
Yeah.
And one of the, would I say, complications is a nephropathy. But hypertension affects virtually all organs in the body. And complications can range from the heart to the kidneys, virtually every part of the body, including the brain.
Okay, how does this really rate, regionally, if you look at NCDs?
In sub-Saharan Africa, the statistics really vary from country to country. Again, because in sub-Saharan Africa we have various economically classified countries, from the low to the low middle income, and some middle income countries. And it also ranges within countries from urban to rural areas. But if you take some of the risk factors in particular, you could say hypertension. That ranges from somewhere like 6% to about 68%. And if we take something like tobacco, that ranges in some countries from 0.4% to even in the high 70s. So in sub-Saharan Africa, it does vary. And that depends sometimes on the wealth of the country. That depends on how urban as opposed to rural the country is. But in essence, in general, the high burden of NCDs across the world is actually in low middle income countries and also sub-Saharan Africa.
Okay, and very quickly before we go on our first commercial break, if you want to, place it in a bracket of age groups, how would you describe it?
The NCDs?
Yes, the NCDs.
Yeah, so most often NCDs have been linked to people who are middle-aged, so somewhere between 35 as people grow older. But that doesn't...
We've heard of children having
that
cancer.
Was just what I was,
yeah,
that was just what I was about to say.
Okay.
That doesn't mean that NCDs in general cannot occur in children. Again, because we talked about the genetic component. Sometimes cancers may present early. Sometimes people may inherit these deficiencies that may present early. So we have things like early onset diabetes, which really does affect children.
Okay, Dr. Joan Alaboson, we'll be back again after this time out. You're still watching the Arise interview. We've got more still ahead to discuss health and wellness in the midst of the pandemic. Stay with us. You're welcome back to the Arise interview with me, Christian Nogodo. Thanks for staying with us. We're live in Nigeria's capital, Abuja. Medical experts have warned that non-communicable diseases such as hypertension, diabetes, cancer, cardiovascular diseases are responsible for the majority of coronavirus deaths in the country. They blame the situation on the nation's years of lack of commitments to the course of NCDs, which had accounted for 29% of deaths in Nigeria. Also, medical experts have expressed the need to strengthen the healthcare system, intensify awareness, increase access to care and treatment, and vote more money for NCD's care and management. As one top medical officer rightly puts it, we need to promote a shift in perspective from sick care to preventive care, where solutions are focused on root causes. Okay, I still have with me Joan Alaboson, a medical doctor and public health professional in our offsite studios. I have Jerry Oguche, a registered nurse and head of nursing department in Peak Integrated Wellness Center with experience in both public and private sectors in Nigeria. Jerry, let's come to you. I'm sure your audio connection is very perfect now. So tell us, can you aggregate for us your public and private health experiences in managing patients with non-communicable diseases in Nigeria? Are the Nigerian medics or health workers up to, scratch in the management of these diseases?
Yes, thank you very much. I believe that we are doing everything that we can with the resources that are available to us. But in my experience in this country, over the years, over time, one thing I have discovered with our people in management is the issue of awareness and education. What I mean is people are not very aware of these things. For instance, we take the issue of obesity. Obesity has become a global challenge, but there are so many people I have come across in the healthcare system in Nigeria who come visit and they don't even know that obesity is a challenge or obesity is a problem. What exactly is obesity, for instance? Body mass index, according to the World Health Organization, greater than 30 kilograms per meter square. It is important to maintain a healthy body weight, but many people are not aware. People, for instance, again, visit you in the hospital and then you ask them, or they tell you, I went to a hospital last week, my blood pressure was checked, and then they told me it was okay. Madam, what did they say? Okay, did they give you any numbers? No, they did not. So there is the issue of awareness. People are not very, very aware. It is important in our setting that we are able to create awareness on these things. Non-communicable diseases, as Dr. Joan has said, is responsible for 29% of deaths in this country. But people need to know. They need to know that blood pressure being high is a problem. They need to know what they should eat, the kind of food. It is not about eating, it is eating right. Then it is not, historically also, non-communicable diseases were seen those days probably as a rich man's sickness. People need to know that it is not a rich man's sickness. It is something that can happen virtually to anyone, okay? So it is important that they know. Awareness, in my experience, has been a major challenge.
Great awareness. I mean, it's always a huge challenge in communicating policies and issues, whether in the health sector or agricultural sector. Now, tell us again, how have you been able to communicate this, particularly at the community level, knowing fully well now that NCDs are not just diseases for the rich, but the poor? As Dr. Joan said, it's more even prevalent in low-income group, regional wise.
Okay. One thing that we have been able to do, and I have been able to do too with some of my other colleagues, is in the community level, it is important for us to be able to come down to the level of the people. You don't go to the community and then you begin to speak medical jargons. For instance, we went for an outreach some time ago, and I just learned there that instead of asking the woman, Madam, are you hypertensive, when you are trying to take her history, it is okay you ask her. People say, Madam, you get BP or something like that. So it is what they understand. It is at their level. Madam, you get BP, or some of them say, I get sugar. That is trying to tell you she is diabetic. So while also talking with them, trying to get history from them, trying to get what they are aware of, it is important to come to their level. Understand how they understand things, what they understand, what they don't understand. And also in trying to create awareness, it is important also that in explaining things, you come down to their level. For instance, when you eat, maybe you are addressing them, it is important to include fruits and vegetables in your diet. It is okay to come to their level. You talk about things like ugu, you talk about fruits, probably in the best way that they can understand. We talk also about exercise, physical activity. You need to break it down for them. It is very, very important. Whatever you need to do, I think that the key is for you to come down to the level of the people.
All right, we've lost Oguche there because of the poor audio quality. Dr. Joan, I mean, he's given a very thorough, brilliant perspective on how to really carry this campaign, particularly at the community level, the grassroots, where a lot of health care is needed because of the peculiar situation that they find themselves and the Nigerian leadership as well. But which really would you put forward first, prevention, curative?
The interesting thing about what you've asked is, curative medicine, or the curative aspect of medicine, is also prevention. Because when you institute curative steps or therapies, you're preventing worsening of the condition, you're preventing complications of the condition, you're preventing death from the condition. So I would say even curative is speaking to prevention. And for me, prevention is key. Not only does it save money, not just the money of the people who are affected, it saves man hours in terms of health workers, it saves the government that has to provide resources directed at NCDs to treat. And indeed, there are best buys, there's strategies, there's research that has shown that preventing NCDs early is actually much more cost effective than treating them in the long run. So yes, that's important.
And another very important aspect, again, as Jerry Oguche was mentioning, is dietary conditions. Not necessarily, just like he said, it's not just eat because you want to eat, but to eat right. Everything seems to be lifestyle.
Right. Indeed it is. It's really about choices. And when it comes to diet, I think you see, sometimes people get to choose what they eat, and sometimes people eat because they see what they eat. I think at some level, it's about giving people the knowledge to make the right choice whenever they go to eat. But on another level, it's about ensuring the right environment is there. So if we're saying more people need to eat fruits and vegetables, are fruits and vegetables available in our markets? Are they expensive or inexpensive? Do they get to the market in a condition that is appealing to people? If all these things are not there, exactly, people would not be encouraged to eat fruits.
Or it could even be detrimental to their health.
Exactly. And you did talk about NCDs starting in adolescents or starting in even younger people when they start to form these eating habits. Okay,
Dr. Joan, sorry to cut in there. When we return after the commercial break, you'll continue on that line of thought. Okay. You're still watching the Arise interview. Plenty more still ahead. Stay with us. Welcome back to the Arise interview. I am Christian Ogoda. Thanks for staying with us. We're live in Nigeria's capital, Abuja. I still have with me Joan Alaboson, a medical doctor and public health professional, and in our offsite studios by Jerry Oguche, a registered nurse and head of nursing department in Peak Integrated Wellness Center with experience in both public and private sectors in Nigeria. Let's come to you, Jerry, before we return to Joan to conclude a line of thoughts that she was on. Let us look at the correlation between non-communicable diseases and the striking, deaths arising from the coronavirus pandemic. What's been your experience like as a field man?
Okay. It's important for people to know, as you have said rightly, that the coronavirus, the death from it is worse or higher in people who are older, and then those especially who have concurrent illnesses or other comorbidities, for instance, diabetes, hypertension, people who are managing that. So it is worse for them, sort of by the reports that we have heard. So people should be aware. Older people during this pandemic are advised as much as they can to stay home. Even if there has been an easing of the lockdown, but it is advisable for older people, especially those who are managing other comorbidities, to stay home and stay very, very safe.
Okay, all right. Let me turn to Dr. Oguche now. You were giving a line of thought earlier, but I thought this issue of the underlying ailment as, being said to be majorly one of the causes of the spike in coronavirus deaths and the rest. And the controversy again over hydroxychloroquine, as even exemplified by an Afro-American nurse in the US. What are your thoughts here?
Well, I think medicine, from its onset or its history, has been controversial and would always be controversial, and particularly with the pandemic, the fact that it's new, the fact that people did not anticipate this, whether in the medical or even in the general public, and the fact that people are dying, and it seems like there is no cure, quote unquote. So this creates a lot of mistrust. And some of these things have already been seen, both in our climes and in different countries. My own view as regards the trending video is, people need to listen. They need to listen in whatever countries they are to the public health officials. As it relates to COVID, that is, we need to listen to wearing face masks, and we need to wear them whenever we're out in public. I know in some countries, even within the house, they have instituted face mask wearing. We need to maintain physical distancing when we do go out. And if there is no need to go out, we need to stay indoors. I mean, these are the public health measures that have been proven. They've been proven to be preventive. I think people should leave the science for the scientists until at the end of the pandemic. And we don't know when that would be. In retrospect, we might be able to see what worked and what did not work. At this point in time, I think it's best to, as people in the public, really go with what public health officials have stated. And again, that is wearing face masks, hand washing, and physical distancing where necessary.
Yeah, and the risk, has been outlined by health officials, particularly for those from the ages of 60 and above, who, like you had earlier outlined, are capable of harboring any of the communicable, non-communicable diseases, yes, and the rest. Besides the normal protocols, the COVID-19 protocols, what other protocols can they observe, to mitigate against the kind of COVID-19 and such fatalities that we'll find?
It's been said that we need to maintain our immune systems. And this can only be done for those who already have non-communicable diseases. This can only be done by adhering to whatever treatment protocols they are on, regardless of what the issue really is. This can be improved by the right kind of diet, eating fruits, vegetables. These have been shown to improve our immune systems. This can also be improved by exercise. It can just be mild exercise while one is home. I know when people are home, most times it's a little difficult. You don't
have to go pumping the weight or running on the treadmills. A little walk,
Take a walk within your
little
house,
table
outside,
tennis or lawn tennis,
exactly.
swimming.
Well, swimming,
Very vigorous.
If the pool is within your house, why not swim within your house? But at this point, it's discouraged to actually go to
The public pool.
Public pools. But whatever exercise one can do at home, sure, and especially for those who are in their 60s and above, or people who already have concurrent illnesses, they need to be on top of this. But I mean, we've also seen that even people who are not in their 60s, much younger people, or people who are not having a concurrent NCDs, sometimes suffer very serious episodes of COVID-19 when they get infected. So it's really for everybody.
And what could be, I mean, what would medical experts attribute to that?
Well, I think we're all different. We all have different genetic makeups, regardless of our age. And so one cannot really tell how people would respond or react in terms of when they're infected with the virus. And that might be the reason why we see these different presentations. Sometimes the young people get away with it, but sometimes they don't. But certainly in older people, they're really more susceptible and actually very vulnerable at this time. And so I think it's important to reiterate that the older we are, the more we need to take care of ourselves. And if people already have NCDs, which have been shown to increase the risk, they need to be on top of that. So this is not the time for people to not take their doses. This is not the time for people to, skimp back on prevention. It's actually the time to talk more about prevention and then encourage ourselves to do this.
All right, let's go back again and to our off-site studio and join Jerry Oguche. Jerry, tell us some of the challenges frontline health workers like you, nurses, who, manage such patients. I mean, patients with underlying diseases and now having COVID-19. It must be very, very challenging. Am I right?
Yes, it is. It is. You see, the thing is, we can only do our best in the times that we are in, but the challenges right now that we have as health workers is basically the provision of protective equipment for us. It is very, very important. Everything that is needed for us to use to protect ourselves, whether we are working in the isolation centers or not, because a nurse or a doctor who works in a public hospital, for instance, is that whoever she or he is will also need protective equipment. But you see, there is a scarcity of these things, and then it is expected that you come to work, and then sometimes in our public settings, sometimes even hand sanitizers are difficult to find. But these things are very important, very especially for health workers who are in the front line at times like this. But it is important that they are provided, especially in the public system. We have everyone coming. We tell people, stay home, but if I am ill and then I need to go to the hospital, I wouldn't stay home and then make it worse. I want to go to the hospital. So people are going to come. The patients are going to come, and it is our responsibility to see them. Now, it is also important that we have things that we can protect ourselves with. It is important that you have the face mask there. It is important that you have the hand sanitizers there. It is important that water is running in our public hospitals. You can wash your hand. There is a liquid soap there. You can do everything that is necessary for you to do, so that yourself, who have a family at home, you will not go and then you contact the virus and then you take home to them too. So those are basically the challenges that we have.
Yeah, thank you, Jerry. Dr. Joan, they are quite enormous, whichever way we want to look at them, because if you have such challenges as frontline health workers, then you can imagine what happens to those Nigerians in far-flung communities where the affordability of hand sanitizer is zero, or constant hand washing and the rest, when they don't even have running water.
Yeah, that's the challenge. That's the challenge that not just the government at this point. I think we all have to take up and try to solve inequality in money, in earnings, inequality in accessibility to basic infrastructure.
That's where CACOV comes in now. The private sector is donated humongous amount of money, and you can see hospitals here, either being refurbished, the new ones coming up, being equipped, having state-of-the-art equipment and the rest. Commendable, right?
Yeah. Those are. I mean, everyone has to pitch in, and sometimes when we think of pitching in for people who are of low socioeconomic status, sometimes the pitching in is even amongst themselves. So it's about community now. It's about looking after yourself and realizing, I might be the one-eyed king among the blind, but I need to ensure that everyone is carried along, because regardless of where we live, in the rural or urban, we're rich, we're poor, once the virus comes in, it doesn't discriminate. And that's why it's so important, going back to what Jerry said, that health workers at all levels and regardless of where they are in Nigeria at the moment need to be protected. And then that degree of protection also sends a message in communities. People see it to be real, and they can actually be encouraged to take the steps that the public health officials have already instituted, like social distancing and hand washing and all of the rest.
Yeah, it's quite an enormous situation, although being surmounted gradually. But I want to very quickly, because we're going to go on a short break again. Now, wellness, the COVID-19 virus. You want to reconcile this?
Well, the COVID-19 again, this pandemic has again put to fore the importance of prevention. But wellness takes it a step further. It talks about you as an individual being responsible for your health. And this is not about the government, this is not about another country, this is about us. And wellness really promotes individuals taking responsibility for their health and looking at where the lapses are. These could be financial. It might mean spending less on irrelevant things, whatever those may be. It might mean sorting out family crises or things that make us emotionally unstable, and then we get to take the wrong decisions, like going out when we're not supposed to, amongst other things. So wellness is really at the level of the individual, and that's about empowering people to make the right choices for their health.
Sometimes some people may confuse wellness with certain herbal medications and the rest. Drink this, it strengthens the heart. Drink that, it makes the blood flow better and the rest. Well, it's time for us to go on break. When we return, I'll throw that to you and Jerry Oguche in our offsite studios. You're still watching the Arise interview. We've got plenty more still ahead. Stay with us. Welcome back to the Arise interview. I am Christian Ogodo. We're live in Nigeria's capital, Abuja. Thanks for staying with us. I still have Dr. Joan Alaboson and Jerry Oguche in our offside studio. Jerry, let me come to you quickly. And I was talking about, the role of wellness first in preventing the non-communicable diseases together with the COVID-19 pandemic. You want to take us through, we know we have to live a healthy lifestyle, both physically and what we consume in our system. What other wellness measures should we be taking so that people don't think of wellness as in all those Chinese herbal or foreign herbal drugs or medications that are, bandied for either preventing or managing or curing one disease or one non-communicable disease or the other?
Okay. All right. Let me address this by looking at health. We look at wellness, and then we talk prevention. Now, the World Health Organization has defined health as a state of complete physical, social, and mental well-being or wellness, and not merely the absence of disease. Now, in wellness, we look at 8 dimensions in wellness. We look at physical wellness, we look at social wellness, emotional wellness, intellectual wellness, environmental wellness, and then some of emotional wellness. Now, wellness is beyond, like you have said, a group of just medications here and there or something, or how do they call it? Concoctions you advise people to take and all of that. There is the social wellness, your ability to interact with people and how it affects your health. In depression, for instance, where one is withdrawn, one is not speaking to people, not eating and all of that, it is important that you have a society around you that you interact with. Now, how you interact with them, are you interacting with them all right? Wellness captures that. It's important to health. Look at your physical wellness, your body, what is happening there. Is there just a headache or a fever and all of that? Health captures that, and then in wellness, we look at that also. We look at your intellectual wellness. We look at your emotional wellness. That is, you are able to manage stress, crisis, the conflict in your life. We also look at environmental wellness. Look at the pandemic, for instance. They say what we've been advised to do is to ensure we maintain physical and social distances. You need to sneeze, you sneeze into your elbow, you clean surfaces and disinfect door handles around you. That's very important. That's about your environment. You need to ensure that it is clean. Apart from the pandemic too, for other diseases, okay, it is important that your environment is kept very neat and very, very clean. There are other dimensions of wellness that we look at. So at the end of the day, you see that the subject of wellness is that holistic package, everything about man. It is beyond just medications here and there that you take. And then there is a saying that prevention is better than cure. Now, should I get treated? Yes, you should. Should I visit the hospital? You should. Whether you are sick or not, one should just walk into the hospital and say, I want to check and all of that. So treatment is good. However, prevention is better. So in wellness, we are looking at, instead of having to take a medication for that condition, why not look forward to what you can do to help you stay away from having it? Dr. Joan had said that it is cheaper to maintain wellness than to treat a disease condition. A few days ago, I heard that a nephrology center in Abuja would have to charge, or they charged for a kidney transplant, 7.3 million. Now, imagine a man who works a job of 100,000. He has 2 kids and a wife. How would he afford that? Now, that's very, very expensive. However, let's take kidney disease, for instance. One thing we can do, or everyone is advised to do, when you feel thirsty, drink water. There are people who they take very little water throughout the day. Now, it is important to stay hydrated. That alone, as simple as drinking water, staying hydrated, it is prevention enough for kidney diseases, for kidney stones, for chronic kidney disease and all of that. Just taking water. So in wellness, we educate you. You need to know what you can do at your level, at the simplest of things you can do to prevent. We say for non-communicable diseases, they are lifestyle diseases. Now, most times we tell people, reduce alcohol, because when you tell them stop completely, it is rather difficult. So it is from one step to another. So wellness is like that whole package. We are trying to see that you don't get sick before you run to the hospital. No. Try to prevent. You need to know first, be aware, then you try to prevent it. Now, whether you are sick or not, it is important you visit the hospital. You could walk in and say, please, I want to check my blood pressure. That alone is prevention enough in itself. Check my blood pressure, check my blood sugar, just things like that, okay? Eat fruits, take vegetables. That's not asking you to take a concoction or something like that. It is important for your health. In the pandemic, for instance, Taking fruit right now is important for your immunity, okay? You need to raise your immunity, so you take fruit, you eat good diet, not just eating when you are hungry. So that is what I can say for now about the idea and the subject of wellness. It is beyond just medications from here and there, or they ask you to take this or that.
That's so superbly brilliant from Jerry Oguche there. I'm sure you don't have anything to add to it, but let me just come to you, Doctor, in this closing moment. I don't know how some viewers or some other people will conceive this, but can it be seen as wellness more of a psychological intuition in lifestyle, joined together? It's not about medication, from what he has said.
Yes. Again, it's shifting the paradigm, shifting the way people see their health. Many times when people think about health, the first thing that comes to their mind is a doctor in a hospital, or a nurse in a hospital about to give them an injection. That's the idea we have. That's our relationship with health. Wellness is shifting that thought and saying, first of all, you have the power in your hand and you can make changes. The truth is, most times when we visit hospitals, we do hear those changes. The doctors or nurses will tell us, hey, Oga, you need to stop drinking alcohol. But sometimes people don't know how to stop drinking alcohol. And maybe the issue is not the alcohol. The issue is his wife, whose relationship he's not been able to build. Now, wellness says, look, deal with your marital relationship so you don't run to alcohol to keep you company. That's how wellness is. In a way, you're right. It's a bit of a psychological shift, but it's about thinking about the holistic person. Every aspect of our lives are intertwined and eventually determine what choices we make.
And moderation too is important in this.
Exactly. And as you've said, moderation. Well, when you talk about things like alcohol and tobacco, we always advise reduce to no. as far as you can go, reduce to no. Wherever you are, you can always take a little less than what you take. And it's a journey. It's not a sprint. It's not a destination. It's a journey as we stay on in the earth today.
Like some doctors will tell you that a glass of red wine is good for the heart.
Yeah, there's been all kinds of, there's been times we've heard it's been good, there's been times we've heard it's been bad. But studies have shown when you tell people do not do something, then they go to do it. It's better to encourage people to reduce. What
can a human being really do or not
reduce. You just keep reducing.
All right, thanks so very much. Dr. Joan Alaboson is a public health expert, and in our on-site studio, Jerry Oguche, a registered nurse and who's got vast experience in the public and private health sector. Thanks for joining us both.
Thank you very much.
Well, that's it for this edition of the Arise interview. Do remember to join us again tomorrow from me and the entire team here in Abuja. Goodbye and thanks for watching.